Welcome. I'm Tim Nelson. I'm the director of the Todd and Karen Wanick Family Program for HLHS and the director of the HLHS Consortium. We're welcoming you today to our quarterly update for the HLHS Consortium. I'm coming to you today from the lab here in Rochester, Minnesota. As a reminder, what we are aiming to communicate to everyone today as a consortium of 11 sites across North America. Our job today is to highlight and showcase some of the updates that we're working on together in the research lab and in our clinical trials. Those that will be watching and joining us today span the clinical care teams of our 11 consortium sites, our basic research collaborators here at Mayo Clinic and across the consortium, and families and friends of congenital heart defects across the globe. We'll be joining with a number of people connecting. Today we'll be giving you a brief highlight, and we'll also be giving you some new ways of connecting with us for a virtual lab tour at the end. So thanks for joining us, and hopefully you'll find this informative. Two ways you can contact us as we go through this update. One is the HLHSconsortium.org. That website is live. There's lots of ways to connect with various team members and see our resources there and our partners. So I'd encourage you to check out HLHSconsortium.org as our website for this group. You can also text me to my text list, which is C to C, that's letter C, number 2, letter C, at 833-222-0186. That's 833-222-0186. Just text me C2C, and we'll have you on our list for future updates. So let's start from the beginning, just with a quick overview of what our HLHS program is, where we started, and where we've come from. So we started in 2010 at Mayo Clinic with a transformative investment from the Todd and Karen Wanick Family Foundation. This started the HLHS program at Mayo Clinic. This was a transformative gift and investment in finding new curative strategies for HLHS. Our mission was to transform the way we take care of HLHS kids and adults everywhere. And it was a privilege to do this at Mayo Clinic, which has a culture of innovation, a culture of transformation. And it gave us a hub to be able to build the clinical teams and the research teams together to be able to do what we're going to share with you today. Our focus has been HLHS from the beginning and to this day. And as you'll hear today, we've grown. We've grown that we can bring this technology and this research beyond the HLHS community without losing focus on the HLHS community. So you all will be welcome to join us as we expand and bring the technology that's being developed and the products that are being developed much farther than just HLHS. But we will never lose our sight and our focus on the HLHS program and the hub here at Mayo Clinic. So what are some of the highlights of our research program? Over the last 8 to 9 years since we've been doing this, where we started from virtually nothing. We started with a vision from Todd and Karen Wanick and their families. We started working for kids like Gabrielle. With that, we've built a research team that focused on basic research of stem cell biology, of genetics research, and of clinical imaging, especially echocardiography. With these swim lanes and our preclinical workflow, we've gone from basic science all the way to clinical trials, which we'll highlight briefly here today. This culture has gone from engaging patients and families like yours as research participants to learning lab that allows us to build the technology into product development that we're going to talk about more later today. A couple highlights on our research. We have, with your participation, consented over 2,800 individual consents for individuals across the globe to be engaged with our research protocols. This is research in genetics, in surveys, and even punch biopsies and bioengineered cells, as we'll talk about today, including cord blood collection for many families. This is a remarkable number of participants, and we're grateful and thankful for all of you that have participated with us in this journey. We went within 3 years of launching this program to launching our first clinical trial with the FDA. This was with our autologous cord blood. Many of you have heard about us talking about this, We've now gone on to phase 2B clinical trials where we've treated over 130 individuals in all of our phases of clinical trials. That's 130 individuals that have trusted us and partnered with us to use cell-based therapies for the first time in the US to test the safety and the efficacy of how we can regenerate and rebuild the heart with these types of technologies. We're grateful for these pioneering families that have partnered with us to get us to this point. Those are a couple of highlights of what we've done and where we're going, and it's the entire end-to-end research infrastructure. One particular exciting area in this last quarter is our Nature Medicine paper that came out with our research team here at Mayo Clinic. We're now able to have new mechanisms of congenital heart disease and new ways of studying potential therapies to treat these devastating conditions. This new insight, published in Nature Medicine, opens up a whole new area for collaboration and future clinical trials. But what are the gaps? What have been the gaps, and what are the gaps as we sit here today? The gaps have been there is no one institution that's large enough to have all of the patients participating in this. We learned this the hard way here at Mayo Clinic. We don't take care of enough patients at one institution to do everything that we're capable of. And so we're grateful for the partnership of families like yours across the country and globe that are participating and engaging with us. And that's the community that it takes to do what we dream about doing. What are some other gaps we have? Gaps are getting the basic research out of labs like this into clinical trials is a massive effort. A different group of people, a professional team of people, getting product development to come out of research studies is something that we think we have answers to, but it has taken us 8 years to build the team to be able to do it. And I'm going to show you more about that later. And it's the partnership of clinical sites, as I already said, working together across multiple sites. That's what gave birth to the HLHS Consortium and our quarterly update today. The 11 institutions that are with us in the consortium start from here in Minnesota with Mayo Clinic and Minneapolis Children's, University of Oklahoma, Ochsner, Alabama, Colorado, LA, Children's Hospital in LA, Cincinnati Children's, Lurie's Children's in Chicago, CHOP in Philadelphia, and now Sick Kids in Toronto. This group of 11 institutions are now working together to sponsor and support the research studies that we're doing in clinical trials. We're grateful to that, and we could not do the number of patients and the scope and scale of our research. We could not do it as fast as we're doing it today without the partnership of these participating partners. So that's why the HLHS Consortium started, and we're incredibly grateful. None of us are big enough to do this alone. Why also do we have patient advocacy groups in the consortium? A big shout out to our first patient advocacy group, Sisters by Heart. With Stacy and Diane, we've been working side by side from day one to send out all of the care packages that are available to all of the nominations of HLHS care packages that come into Sisters by Heart. Just upstairs from us right here, we package those boxes and make sure every family anywhere in the country gets one of those care packages that I know so many of you have been appreciative of. We'll continue to do that and find new ways of communicating and engaging with the HLHS community with partners like Sisters by Heart. The other advocacy group, awareness campaign group that we've been proud to partner with is Greg Olson. Greg Olson's Receptions for Research has been a wonderful partner. We've had a great friendship over the years. We've had a number of events together. He recently did a podcast with us. And if you haven't seen what he has done with Levine's children in North Carolina and the program that they've launched is a true inspiration to what our community can do when we band together. So big shout out to Greg and Carr and their family, TJ, and all that they do with the Receptions for Research and the partnership that we're going to continue to grow with that as we go forward. Ultimately, we can't do it without these families, without the families that we've already talked about. And so we're grateful for these patient advocacy groups to increase our awareness and increase our partnership to be able to do what we do. So today, I'd like to spend time not focusing on the things I've already highlighted, but to go back in time a little bit, and to go back in time in 2013 when we launched and communicated our first product that we started working on from the very, very beginning. I remember the day when I sat in the conference room with Todd and Karen Wanick, and we talked about this technology. And we said, if we can do it in a small animal model system, why can't we do it in patients? And why can't we make this a reality? Let me show you a video that shows where we were in 2013.
What if you could stockpile a set of spare parts, not for your car, but for your body? You know, extra heart, some fresh lung, a better eye, all grown in a lab from a piece of your skin. The idea sounded like science fiction until a team of doctors at the world-famous Mayo Clinic took a tiny piece of my arm into a lab, turned it into living cardiac tissue, and let me watch it beat at the same rate as the heart in my chest. It is part of a Nobel Prize-winning breakthrough spurred by a race to save kids like this.
That's my dad and my mom.
Meet Sophie. 30 pounds of molten cuteness. Watching this 3-year-old motor around her Minnesota home, you would never know she was born with half of a functioning heart. How old was she when she had the first surgery?
4 days.
4 days. Mm-hmm. So her heart was the size of a grape.
Walnut, yeah. We got to see it beating inside her chest before they closed it up.
Really?
Too.
Yes. Yeah.
Are you wearing lipstick or are your lips naturally that rosy?
Ooh, that's a great thing to hear. They're usually nice and blue. Oh, Sophie.
After 3 open heart surgeries, she's doing well. But odds are that Sophie will still need a heart transplant to survive into adulthood. Like Coulter.
This is my action figure Han Solo.
Born with the same condition, he's had 2 transplants.
That heart's not going to wait much longer. I'm getting it.
And is now on his 3rd heart at age 10. Hang around with kids like this, and you can't help but marvel at the medical talent that can hold off a genetic death sentence. But hang around with the medical talent at the Mayo Clinic, and you'll witness more frustration than pride. Because despite their skills, they know there aren't enough little hearts to go around. There has to be a better way. And Dr. Tim Nelson thinks he knows what it is.
We're here to talk today about stem cells and regenerative medicine.
Yep. Regenerative medicine, the belief that one day doctors will fix our diseased or broken bodies with healthy spare parts grown in a laboratory.
Okay, you'll feel a little pressure here.
And he's asked for a chunk of my flesh to prove it. And you're gonna put it in that jar. Mm-hmm. A little blob of arm goes into pink liquid and then onto a lab where they will turn my skin cells into the kind of stem cells that formed me as a 3-week-old embryo. The kind of stem cells that can then be coaxed into becoming brain or lung or eye or any other part of my body.
You can see various things on the bottom of this plate.
Looks like mold or something.
These are human cells that are growing in there that are forming different types of tissue. And we're guiding this tissue into specifically the heart tissue.
Yeah. Yeah. It's pulsing, it's beating.
So you are actually looking at somebody's heart muscle right now.
Wow. And that didn't come from a heart, it came from skin, like mine. But Dr. Nelson has decided the demo would be a lot cooler if I became the first person to come to Mayo and see his own heart beating outside his body. So I promised to return in a few months. Hey, Doc.
Mr. Weir.
How are you?
I'm good.
Good to see you again. How's little Bill?
Little Bill's doing great. We got some good things to show.
Really? Oh.
Hey guys. How are you?
Hello. These are my heart cell babysitters, right?
These are. This is the house that your cells have been living in for quite a few months.
Right.
It's not the best accommodations, I guess, but it's as good as we've got for them.
It's cleaner than my apartment.
It's clean. It's warm. They get fed every day.
Right.
So
to see what's become of my arm hunk, Dr. Nelson has me saddle up to the microscope. So this is me.
You can adjust the eyes here so you can see it, but
this is my heart tissue beating outside my body. Oh yeah. Little Bill is pumping slow.
So this is a pretty calm cell right now.
You can see why this kind of medical science just won the Nobel Prize. Why a company like Cellular Dynamics in Madison, Wisconsin is growing billions of cells a day so drug companies can test new medicine on the living tissue of specific patients instead of mice. And without any of the controversy that comes with harvesting stem cells from unborn children. Wow. Oh man. Now that is cool. Dr. Nelson gets most excited when he shows me a tiny piece of my heart tissue that looks exactly like a heart, a pumping, three-dimensional glimpse into a future when this kind of cell could theoretically get injected into a heart attack victim or a diseased child and literally mend broken hearts.
This is a functioning tissue.
That is the hope. But while these cells could grow hearts or lungs or brains, they could also grow tumors. And it could be years before the science is ready for the first clinical trials on humans. I know you have to be cautious about predictions, but in Sophie's lifetime, could this save her? Could this build her a healthy heart?
That's exactly what we're working towards as a program.
And she's such a good mommy. She rocks her babies.
Right.
Plays with them. And then in my heart, I get very sad because will she get to have babies one day? Or is that something she won't get to do? Those are the things that I get to think about and worry about.
The science is moving fast, but not fast enough for families like that. Thanks to them, and thanks to the Mayo Clinic. Much more at abcnews.com.
So many of you that are watching this have participated in that video where we've produced your human heart tissue and done it in our cell lab culture system. This is because of your donation of your skin sample that then allowed us to put it in the lab, reprogram it, make the beating cardiac tissue, and allow us to study that in a lab like this. What we've done with that is we've learned a couple of really important lessons. One, kids with HLHS can produce very normal heart muscle in the lab. We've done this hundreds of times. We've studied it in the lab. We've understood that its gene expression, its protein expression, its electrical physiology is very, very similar to the moms and dads and their siblings that we've made it from as in parallel. It's also true that there's some families that do have a genetic mutation in the family that contributes to HLHS that does cause the cells to be compromised at some level in the lab. So we're learning that, but the majority of families, the HLHS kids and young adults produce what's normal heart cells. This is really important to understand. The other thing that we've learned is that this is a costly, time-consuming process to do what we did with Bill Weir, to take a piece of skin and make his heart. Bill Weir's heart is probably the most famous heart tissue that anybody's ever watched beat because we've showed that video so many times. It takes a lot of effort and time to do that, and money and resources and people. Most people use it for drug discovery and other mechanisms of academic studies and grants. But what we have been committed to the day that we committed to Sophie and her family is that can we go on a path to make your heart available for clinical trials? And so to remind you, we were doing that under a microscope in a plate like this. Today, we're doing it in jars like this. And inside this jar is a model of a human heart when it is born. We now can grow the cells from stem cells and differentiate them in jars just like this, in spinner cultures, in large-scale bioreactors here in our biomanufacturing facility to make enough cells that are genetically identical to the size of a human heart when the baby is born. This is the scope and scale that we're now doing this technology at. We're building human hearts. We're building them as cells. They're small granulars of tissue, and we're now making that, tested it back in the lab, doing it in preclinical testings, and we're on a glide path with the guidance of the FDA to be able to do this for the first time in human clinical trials. We expect that at the end of 2021, we will have completed all of our preclinical testing with the guidance from the FDA to be able to work in early 2022 with launching the first clinical trial that tests these cells in clinical patients with congenital heart disease. This doesn't happen because of the lab we have. We're not able to do this grand vision with the people we have, but we do think we're on a pathway to be able to build the teams, build the HLHS Consortium, learn from the clinical trials that we're doing right now, and scale the production of this novel therapy to make it testable in clinical patients. What makes us unique and different is our partnerships, And what makes us unique and different is our singular focus and commitment to building autologous human hearts, building hearts that are genetically identical to the patient's, and finding ways to make structures and forms and injections that these cells could be tested to improve the heart function of kids with congenital heart disease. We're not aware of anybody else in the world that's taking on this focus, this bold, audacious goal of making autologous human hearts for congenital heart defects. This is our commitment. This is our pathway. We're grateful for the HLHS Consortium, and we're grateful for your partnership to allow us to grow and build. That's where we're at. That's a snapshot of where we're going. We'd love to give you a virtual tour of our lab. And if you connect with us with our text messaging or going into the HLHS Consortium, there's multiple ways to connect with us. All of them can feed into our pathway to get a virtual lab tour set up for you. So finally, I'd like to highlight a couple of our partners that are allowing us to take this bold goal and move it forward into product development. First, Beats for Bella. Thank you. Beats for Bella has been a great partner with us for many years, have been doing a golf outing. We've been there. They've been come and visit us with our Feel the Beat. And this year, we're in the middle right now of a Beards for Bella, where we're growing beards to raise money and raise awareness for HLHS. And the Beats for Bella organization has continuously contributed to this effort and has helped us pioneer some of these product developments. So thank you, Aaron and Justin. Thanks, Bella, and your whole team of people that are growing beards right now. I've already mentioned the other two sponsors that we work with Patient Advocacy Group, Sisters by Heart and Greg Olson's Receptions for Research. Today, we're super excited to announce a long-time partnership that's matured and grown into what we are calling today HeartWorks. HeartWorks is a group of like-minded people that have been working together for a long time and now are ready to form an entity to support the HLHS Consortium. And with us today is Matt at HeartWorks to highlight what we're doing today with our partnership with HeartWorks. Matt?
Thanks, Tim. HeartWorks is very excited to be the newest HLHS Consortium member. HeartWorks was created in June of this year to accelerate and expand the product development pioneered by Team HLHS. The products being developed with an intense focus on HLHS show great promise for expanded use within CHD. By expanding the reach of Team HLHS, HeartWorks will develop products to cure CHD. Participation in HeartWorks is a unique opportunity in the CHD community. Until HeartWorks, there wasn't a nonprofit focused on developing cures and therapies for CHD. HeartWorks is 100% focused on product development. HeartWorks provides an opportunity for you and your friends to participate in developing cures and therapies for CHD. Funds raised by HeartWorks will go to developing cures for CHD. Let me show you our website. So you can see on the top, HeartWorks, we build hearts. What I want to talk about a little bit in the We Build Hearts is the we. I'm asking you to become part of the we in We Build Hearts. To become part of the we, simply go to this webpage, which is webuildhearts.org. webuildhearts.org, and buy a t-shirt and a coffee mug to start spreading the word. That's how I'm asking you to become part of the we. Join us. My second ask is that you recruit your fellow CHD friends to become part of the we in HeartWorks. We have a large HLHS community. Let's grow it to more of CHD. Let's provide more hope to more families by expanding this pioneered research that's been led by Team HLHS. So HeartWorks is going to be giving away, if you go into our shop here, is where you can see some merchandise, and it'll help us fund things and it'll help us spread the word. One thing we're going to do here is we're going to give away your selection, so you can choose something off this website once a month to a lucky winner. How to enter the drawing is to simply tag us on Instagram and or Facebook with your photos. Each tag to the HeartWorks Instagram and Facebook will enter you into a monthly drawing. Each tag gets you an entry. The more tags you have in a month, the more chances you have to win. Another exciting opportunity on this WeBuildHearts.org website is right here called lab tours. Okay, these are going to be virtual lab tours, and we're going to limit them to 20 spots for each scheduled time on here. So go in here and sign up and grab your spot so that you can get a tour of the lab that Tim is talking from right now. It'll be interactive, it'll be small group, we'll be able to answer questions, and we'll be able to take our time bringing you through the lab. So make sure you go out there and get signed up. I want to thank you for your time today, and I just want to make sure you go sign up for your lab tour and grab a t-shirt, and I look forward to seeing you on the tours. Thanks, Tim.
Awesome, Matt. I think what this highlights for us is we're building an entire ecosystem of partners. As we talked about already, we can't do this alone in any one institution or any one nonprofit or any one foundation. What we're doing is we're building synergy and we're vertically integrating this product development cycle. So as Sisters by Heart, with HeartWorks, with Receptions for Research, we're building complementary, integrated teams of people to be able to stay focused on HLHS, to be focused on building hearts, and to be focused on building autologous heart solutions that can cure congenital heart disease. There's nobody else in the world that is doing this. We're so grateful for your partnership, and we're so grateful for the partnership of Todd and Karen Wannick and their entire family. We work for Gabrielle and kids like Gabrielle and all of the HLHS adults out there today. It's this community working together synergistically on the hub of the research that we started at Mayo Clinic that allows us to have true hope and true inspiration for a brighter future tomorrow. So thank you. Thanks for joining us on this quarterly update. We'll plan to continue to do this next quarter, show you some updates on some of the research and clinical trials that we're doing. And don't hesitate to go connect with our partners. And thank you to HeartWorks for sponsoring and supporting our product development ecosystem, and especially the virtual tours that we're going to start doing now. So sign up. We hope to interact with all of you very soon. Have a great day. Thanks for joining us.